The PACT program, in various forms, has been around for over 20 years. Initially, the heart transplantation program existed more or less in isolation. We then started a pediatric heart failure program. Instead of having separate teams, we brought everything together under one group called the PACT program to focus on the longitudinal arc of a patient and do our very best to maintain their health throughout the continuum of these situations. The patients who we take care of are among the most complex patients in any program around the nation. We take care of children with all diagnoses up until the age of 25 years. At present, we are consistently among the highest volume programs across the United States. Our heart transplantation program performs approximately 25 heart transplantations per year. Additionally, we implant between 10 and 15 ventricular assist devices, or VADs, each year. Cumulatively, we have performed over 440 heart transplantations to date and implanted over 160 VADs. We're frequently referred patients from other institutions because of their complexity and risk. Despite taking on patients of this nature, we have outstanding outcomes for both pediatric VAD support as well as for pediatric heart transplantation. Stanford performed its first pediatric heart transplant more than 30 years ago, and we have been in continuous operation as a transplant program since that time. We also have a very long-standing pediatric heart failure program going back 17 years, which was one of the very first to start in this country as well. Because of that long tradition, we have a staff here with many decades of experience. Between us, we have well over 100 years of experience. One of the most important aspects of the PACT program is its commitment to innovation. We have been among the leaders in applying pediatric VAD therapy to different populations of children. We have been among national leaders in developing clinical trials to test different therapies for transplant immunosuppression. And most recently, we have pioneered a practice of using CT scans of the heart of both the donor and the patient to try and understand how to best match donor and patient and reduce the time on the transplant waitlist. One of the aspects of the PACT program that I'm most proud of is the strong multidisciplinary nature of the team that comes to bear on taking care of patients. We take care of children with genetic forms of cardiomyopathy or those who are at risk of developing cardiomyopathy. We take care of children with symptomatic heart failure, as well as those with congenital heart disease who require management for heart failure. Additionally, we take care of those children who are candidates for heart transplantation or have already received heart transplantation. We have skills to take care of the most complex patients, and we are situated within a heart center that offers the full range of options as alternatives to transplantation. One of the things that sets our program apart is a very strong collaboration among the different organ transplant programs at Lucile Packard Children's Hospital. Arising from that strong relationship, we have built a program here to evaluate candidates for potential heart and liver combined transplantation, and we have performed those transplantations successfully in a number of cases. We concentrate on getting the very best results we can for every patient we take care of, while at the same time trying to understand how to advance the field for the next generation of providers and the next generation of patients so that they can enjoy even better results than we can get today.